polar switch. It's the same energy level, but we switch from having a lot of protons in acidic blood to venous blood that's too alkaline, where we're not getting the waste out into the blood anymore. And that's where we start seeing, we see bacterial infection, not the friendly bacteria that we should have 2 pounds of in the gut. The friendly bacteria are actually aerobic. They like oxygen just as much as we do. They're part of our whole ecosystem. And they make B vitamins, and they break down fiber into compounds that feed the lining of the gut and even feed the heart muscle. They make bulk. They help us with digestion and elimination. They make enzymes that help us break down our food. But the harmful bacteria start showing up when there's not enough oxygen. So we're already anaerobic or hypoxic, low oxygen in the fungal state, phase 3. Phase 2, we've got areas in our body, maybe the colon, for example, becomes alkaline. Well, it should be acidic. Lactobacillus acidophilus means acid-loving. So they make weak organic acids that can feed the lining of the colon, feed the heart, and that's how it should be. That acidity creates a fluidity and a movement. When things become alkaline, they become more solid, more fixed. And so when that happens in the colon, we have constipation and lack of oxygen, and the stuff's in there too long, and the harmful bacteria start breaking down whatever we haven't digested, especially proteins. You get putrefaction, you get bad smell, which is very toxic. Indole from the small intestine, scatol from the large intestine, they're absorbed into the body, and then the kidney has to filter them out. Highly toxic compounds from proteins that we didn't digest. We also, in that same terrain of phase 2, we get not just the harmful bacteria, we get parasites. Well, if we're not occupying the space, if we're not digesting the food, someone else is going to. And if we don't have oxygen there to feed the good bacteria, the ones who are harmful to us, well, they don't need the oxygen. That's their job. It's not that they're attacking us, it's that they're helping do the jobs that we're not doing. We want to occupy ourselves fully, physiologically, and clean up the terrain.
Would you say that parasites show up in stage 2 or maybe already in stage 3?
Phase 2 is where he found the terrain, the conditions for parasites, and at that time the main cause of death in that type of terrain where the water supply measured the same as the blood in phase 2 was bacterial infection. And the reason was, this was starting in the 1930s, we weren't putting chlorine in the water to kill those bacteria, and that's why we put the chlorine in the water, to kill those bacteria, because there can be harmful bacteria. And this would be surface waters. These were communities that got their water supply from the river, from the stream, and guess what? There's another community upstream. And so we're drinking the bad bacteria and polluted waters. Surface waters was the issue. It's no longer so much the issue. It would be if you're drinking polluted waters that aren't treated. But then we started treating waters, and that changed the terrain of the water to a phase 1 water. It oxidized it. It took the electrons out. Remember, the phase 2 was alkaline and reduced. It had electrons, but not protons. So when we put chlorine in the water, we're killing the bacteria because now there's no electrons. There's nothing for them to live on. It's an oxidizing agent. We're oxidizing the organic matter, so there's no job for the bacteria to do. It's actually putting it in a low energy terrain. It's basically dead water. It actually has a high oxidizing potential. It's an oxidizing agent. Chlorine, of course, is a deadly gas, and we're exposed to that gas when we take a shower in chlorinated water because we're making fine droplets and we're heating the water, and that off-gasses the chlorine from the state it's in the water, which is going to harm us, but as a gas, even more so, more directly. So we want to always take the chlorine out of the water if we're drinking treated community water supplies. And carbon filters are a very simple way to do that. More sophisticated filtration can take out lots of other things.
So how did this doctor deal with his patients back then?
Well, he wasn't a doctor, but he developed systems, measurement systems for the physicians, and together with them, to measure the blood, the urine, and the saliva, the fluids in the body, and measure the electrons, the Rh2 factor, the oxidation potential, the pH, or the acid-alkaline balance, which is a measure of the protons, and a third factor. These three factors go into a physics equation called the Nernst equation that measures, that calculates energy. So when we talk about energy in holistic medicine, and the professors and the physicians roll their eyes, oh, they're talking about energy again, we don't know what they're talking about. Well, in the field of European biological medicine, they do know what they're talking about. If you want to talk science of energy in a liquid medium, it's the Nernst equation. It's the electrons, the protons, and the photons of light, which determine, we don't measure them directly, but they're in there. It's the quantum energy, and we measure it in terms of resistivity or conductivity, the ionized state of things. If you have salt, like sodium chloride, and it's in a table salt crystal, and you put that in a fluid, it's going to ionize. Well, there's light energy in that energy, that ionization energy. If we have enough light, enough quantum energy, we can ionize toxins in the body, and that gives them electrical charge. Our body is electric, and allows us to move them with the current flow in the body that runs through every meridian and electroacupuncture vessel in the body. It's one of the ways that we clean the tissues, along with the lymph, which is a vascular, pipes. The lymph is like an open-ended pipe that has an end near almost every cell. There's a few tissues that don't have those, like in the brain. But most of our tissues have these lymph vessels, and then the extracellular fluid can flow out through those pipes. Yes?
What kind of diseases do you find in phase 2, you were saying?
So the diseases, I mentioned bacterial infection. Again, that was the major cause of death at that time that he was finding. You have parasitic infections, kind of similar. You have also rapid aging. And at that time, most people, when they died in phase 2, often the bacterial infection, or just going downhill rapidly and dying. Phase 1 is actually where most people die now, because we're putting the water into that phase 1 zone. We're avoiding the obvious infectious agents that our culture recognizes, but it's less on our mind that by drinking chlorine, we're depleting our body's electrons, which is, we're born with lots of electrons, and we die without electrons, especially in this culture. We're born with lots of water. We die without much water in our body. An infant is 90% water. When we die, as we get older, we get less and less. When we die, it's maybe 50 or 60% or less. In phase 1, with low energy terrain, we start to have viral infections. We have degenerative diseases. We have cancer as one of those degenerative diseases. It's kind of the ultimate one. And in the extreme low energy, we get cancer, where our body just can't get the lactic acid out of those cells. What is a cancer cell? It's filled with lactic acid. What's the metabolism of a cancer cell? It's anaerobic. It's that fungal metabolism that, the areas that aren't getting enough oxygen from phase 3 on down start to be the areas where we form cancer. It's an area where there was damage and injury and trauma before. A good reason maybe to find better ways of diagnosing breast cancer than doing trauma to the breast and giving it radiation that causes cancer. And I think we can look toward a day in the near future where we can create much more effective means of helping the body to heal these things than by thinking that we're going to do something to the body based on trying to essentially to kill the diagnosis. If a diagnosis of a disease, like let's take high blood pressure, if the blood pressure is high, well, it's really a function. The body's making the pressure high, it's trying to do something with that high pressure, usually filter the blood through the tissues, especially the kidneys, which are the high pressure filter. So if we think of the measurement of blood pressure as the problem, we're going to think that it's okay to put a toxin in the body that blocks some body pathway that stimulates the heart to pump the blood and make the pressure high. And so we brought the pressure down to a normal level, and we measure the pressure, and we say normal people have this pressure and you have this pressure. So you're going to get used to taking that drug unless you complain too much of side effects, and take it the rest of your life. And we're preventing an aneurysm from blowing up, right? The problem is it doesn't solve the problem of having too many protons in the blood that's making it thick, that we're trying to filter out to the kidneys. Now we're filtering even less, and we're adding another toxin to the mix. We're actually adding a new disease to the picture, where what we want to do is remove causes of disease and help the body to heal itself. If we cut ourselves, the healing process is something the body does. A Band-Aid doesn't actually heal it. A drug doesn't heal it.
So would you say that stage 1, is there a return to health from that stage, or
yeah,
is
and
that's the final stage?
Well, what we're going to talk about in the next segment is the path from phase 1 back to phase 5, and it is definitely possible. Not in every case. In fact, in the method that Professor Vincent came up with of measuring the body fluids, they can determine by that measurement if a person, let's say they have cancer, if that cancer is likely to be irreversible even with the best natural medicine. But they can also determine if it's in a reversible stage. So yeah, next time we're going to talk about that process, which is the basis of where I came up with the idea of the 5 phases of health as a roadmap to health from whatever level of imbalance we're in, based on the half a century of European biological medicine experience, where they're measuring where the people are and seeing that not only as people are getting sick, they're dropping in health energy level, but as they recover, they go up in energy level. Just an example would be 3,000 cases of spontaneous remission in the medical literature. In every case, the cancer disappears in a few days. And in every case, there's a bacterial infection. So just from what I've shared with you today, you can identify that they've gone from phase 1 to phase 2, and that's what's seen in the Bioelectronics of Vincent blood test, that, they've switched. There's now electrons. There's now bacteria that are able to produce enzymes that maybe are blocked in the human physiology systems, but those bacteria are able to break down the toxins that are stored in the cancer cells. And if the kidneys are working well enough, if there's enough support to eliminate those from the blood, the person can actually heal cancer, even systemic metastasized cancer in several days. Again, 3,000 documented cases of that they call spontaneous remission. I think it's interesting to call it spontaneous. It's as if there is no cause or no process to it. Well, the process just has to do with something that's not in the control of a pharmaceutical company and a patent. But there's over 200 different bacteria that have been identified in that process in different people. And so are bacteria our enemies as we think of them in this culture? If I have a bacterial infection, is that really the problem? It's maybe I can see it as a problem. That's an interpretation. I can also see it as a potential solution. If I have cancer, I might want to ride out that fever at 100, 200, 3, even 100, 405 degrees, not let it go higher than that. But we're using hyperthermia. We're artificially inducing fever from the outside to treat cancer now, even in Western medicine. So I think there's a lot that we can learn from this background of experience of European biological medicine, watching people get well, watching them get sick, and seeing that it's the same path that we walk from health to disease, that we can support the body in reversing that process.
So in being aware of the 5 stages of health, what does this look like as far as what people should want to know or learn about a roadmap to better health? Well,
I find it super helpful when when I'm working with someone who's healing themselves, if let's say a person is going through a crisis, is that a healing crisis or is it a disease crisis? A disease crisis might be a bacterial infection that's going to kill you, and a healing crisis might be a bacterial infection that's going to heal some deeper disease. And there are differences that we can identify, and just to realize that either one of those is possible. Now we know to pay attention, like, how are my elimination systems working? How is my energy? How is my spirit? How is my sleep? How is my mind? How's, those core things to who we are as a living soul are the most crucial to watch, but including elimination. I mean, if you're not urinating and you have a high fever, that's a problem, because your kidneys aren't cleaning the blood and you can only live maybe for a day at that rate. But if you have that same level of fever, maybe the same bacteria, maybe the other symptoms are quite similar, but at the same time you're urinating maybe more often than usual. Maybe there's even a little irritation to it, but and maybe there's a strange color or odor to it. Well, that increase in elimination is a good sign. Sweating. You're sweating, you're eliminating. That's bypassing the kidneys. Maybe the kidneys can't get it out, but you're sweating it out. Great. Get it out and wash the sheets, because they're kind of, it's not just clean sweat, it's like you're getting out nasty stuff. The sweat is produced by the sweat glands in a very similar way to the kidneys producing urine. We call it a third kidney in natural medicine. If your bowels are moving extra. Now, again, there can be issues if you have diarrhea and you're not replacing your fluid and your electrolytes, and that goes on, you can die from that. That's a serious thing. But the body often, when it's in a healing crisis, will use that for a short period of time, a sustainable flush and cleanse. And do we want to necessarily plug that up, take something that stops the bowels? No. But we do want to replace the fluids and the electrolytes and be aware of making that judgment call, that triage. Am I going through a healing crisis? So I want to rest and drink fluids and have support to ride that through, help my body with it. Or is this a disease crisis where maybe it's time for intervention type of Western medicine or some other intervention? And there's many ways. There's natural ways. An enema could be a really good way to intervene. It's not the natural direction our system flows, but it can sure help clean out a toxic colon that might be causing us to have to go through a lot more pain and suffering and time in that crisis.
So what is your goal with this model of health?
My original goal with the model is to have a way for a doctor to teach their patient to understand the healing process. That it's not just about managing the symptoms of the disease. It's actually about hoping and praying and supporting for that transition to a whole new set of symptoms, a different disease, and where there may be a transitional period, often, most typically a day or two or three, but sometimes it could be a month, where you're going through a healing crisis and there's some intensity, some increase in symptoms. When in a later segment we're going to talk about regulation, but just to mention it,